That brings us to the end of our formal presentations from all our companies today. And now we're going to move on to our sort of question and answer and discussion session. And I'd invite all the panelists to switch on your cameras and unmute yourself as well, so that we can have some questions and discussion. So I guess I'll kickstart the conversation by posing a question, I suppose, to all the panelists. We're in the middle of the pandemic, and I don't know, second, third wave, fourth wave. It's sort of never ending. But what I'd really want to get your views on is, in your opinion, what are the key challenges that healthcare establishments will have in the medium to long term beyond COVID? And what in particular is your organization doing to address those challenges? So if I might start with Jason.
Yeah, thanks. Yeah, I think for us, because we're still heavy in R&D, where we noticed it immediately was around clinical trials. So I'm sure it's an issue that a lot of people are going to have, but there are really two distinct features for us. One was, recruitment of new clinical participants. So whenever the sites or whatever were shut down, or there were heavy restrictions, you really had to do a kind of risk-benefit analysis where you were bringing someone into a hospital environment, say, to start them on a clinical trial. So if the university site or the hospital site actually stops you doing that, then there's not really much you can do. But then the other area where this becomes really relevant is actually people who are already on the trial. So if they can't actually return to, say, close out their clinical trials or finish or say have another midpoint assessment or whatever, it becomes quite difficult to know actually what to do, because do you just keep these people ongoing? Do they just get the potential treatment forever until the site opens up again, or do you stop that person and you lose all the data? So thankfully, our relationships with the FDA has been really beneficial in that, and we were able to have sort of emergency teleconferences with the FDA, and we set up plans to actually maintain all of our trials. So thankfully, what we have been doing has been, we've come out of that really positive. And then I suppose the knock-on for that, and I'm sure lots of other sites will find this, is it's now much easier to push for remote recruitment. So previously that was kind of frowned upon for some clinical trials. People wanted you to see the participants face to face, to have signatures, wet signatures on paper, whereas now the FDA and the other authorities are really opening up to this idea that in fact you could remotely onboard someone and start them on a clinical trial.
Okay, Mark.
Certainly, I mean, as I touched on in my presentation, our big challenge was global mobility. It was once the borders closed and the flights stopped for virtually for 6 months, we couldn't move people around the world, and that was a huge issue. We had a large backlog of individuals who were due to come and join businesses and hospitals out in the Middle East, out in the UAE in particular, and for that 6-month period, things were put on hold. But thankfully, we've now got to the end of that backlog. I suppose in terms of the wider staffing market, it is really about finding those skilled individuals. A lot of these talent sets, a lot of the niche skill sets are in high demand, and regardless of where in the world these individuals are based, it's targeting them to come and work in whichever part of the world that those client needs are. So those skill sets aren't a quick fit. So it takes many years for a lot of people to train appropriately for some of these roles, and that is going to continue to be an issue for many organizations.
Mm-hmm. Roy?
Yeah, well, I think for us, COVID-19, the whole pandemic has just highlighted how vitally important it is to try and do everything you can to stop the spread of infection. So you think about it at the moment, the globally accepted method of taking a patient's temperature is to use a tympanic or an ear thermometer, which is just a thermometer. You put a little cap on the end of it and you stick it in a patient's ear. And it's a massive source of infection, never mind discomfort for the patient. So for us, being able to show that there is an alternative non-contact device, which is not only accurate but reliable, and we provide a black body device calibration checker to actually allow the hospitals to confirm the accuracy, I think that's going to be a major game changer for intermittent patient temperature measurements going forward.
Okay, Philip?
Yeah, for BioPanda, it was really just to focus on the importance of point of care testing. not just that, but just that the point of care tests that are available are of the highest standard. I think there was much controversy in the news about lower standard products that were being sold in the market. And of course, we pride ourselves in producing the best quality out there. And just even education of the importance of point of care testing with ministries of health and even any healthcare setting is a big issue for us.
Neil?
It's a good question, Fad. I'm a typical glass is half full person. When I see a challenge, I see an opportunity. And not just for SIGA Healthcare, but for all the other companies here, we've all faced challenges, but by and large, we've all sailed through them. But if I'm being incredibly honest, our biggest challenge is that people want us to come out to visit them just to go through some operational deals. They don't really like doing, like, if you like, being on Zoom or being on Skype or GoWebinar. They actually want to come out and see you. So it's an inability to be able to go out to see people. I think that is the big problem. And until everybody essentially has got themselves vaccinated against COVID-19, it's going to be a considerable period until we get back to relative normality. Because a lot of people, I suspect, think, oh, I won't go back to normal. The truth is, it might, and it might not. So the real challenge is trying to create the conditions to get us back to what we regarded as normal pre-COVID-19.
Yeah. Paul?
Yeah, so look, life sciences as an economic sector has always enjoyed a relatively strong growth, irrespective of what's going on in the economy at the time. We can see that back, especially in the UK in 2008 recession. And various subsectors of life sciences were always forecast to have a certain ebb or flow, whether it's precision medicine, diagnostics, AI, etc. I think COVID has refocused and sharpened the pen or sharpened the pencil in some of those areas. So we're seeing, obviously, and this ties in with what Jason saying, the challenges in running clinical trials has meant that actually technology can meet that. So remote patient monitoring, point of care diagnostics are two of the areas that are really becoming the sharp focus. The healthcare systems around the world realize that actually those two components could save patients the time and effort to come into say their GP or their clinician, save money, and provide a very effective healthcare system. Albeit all the other subsectors of life sciences, the precision medicine area, the pharma biotech, the clinical trials, all the health and well-being stuff is still on a growth trajectory. There will be short-term challenges in the next 2 to 3 years, I still think, in terms of getting back to those normals. But I think long-term, remote patient monitoring, point-of-care diagnostics are certainly here to stay and a growth area.
Liam?
Yeah, I suppose for us, the sweet spot for our technology, our patient care communications app, is ICU, kind of critical care environments, and those unfortunately are, the environments that are kind of critically overrun at the moment. I mean, we've talked to ICU consultants who haven't had a day off in kind of 30, 40 days. So when you're trying to enlist their help in trials to trial your technology, it's because it's not their biggest priority, they're saving people's lives, that's been a bit of a challenge. But I suppose on the flip side, with the rise in COVID patients and these patients needing ventilation and tracheostomies, this inability to communicate has become a massive issue. So a lot of the ICUs that we're dealing with, even though they're completely overrun, they've managed to create little teams of junior doctors and nurses to use our technology with the patients. So, hopefully, it looks like certainly in the UK the numbers are starting to go down a little bit. So, hopefully that situation will get better and better. But yeah, that's been a challenge for us.
Yeah, and Jeffrey?
Hi everyone. Yeah, I think I would echo what a number of the panelists have said regarding the difficulty in traveling because of the pandemic. The nature of the businesses that we're in and our clients, which are hospitals, critical care consultants, etc. It's not really feasible to do this by telephone or email. So not being able to get into the various countries and meet with them is difficult. Although hopefully with the, as Neil said, with the vaccinations now coming on stream, that will free up towards, I guess, toward the end of the year. I think the biggest thing that we found with the pandemic, while it's been beneficial to us, sadly, not so to other people, is that it's reinforced the critical requirement to sanitize. I think it was an area which was taken, not lightly, but maybe not as seriously as it is now. That is now, I think, with this day, people now realise that they have to take this very, very seriously, because people are dying as a result of it, and that has led, to our success having a product like Medizar. So I think we all would say, as soon as this thing is over, the better we can get on with our lives, and I guess we all look forward to the back end of this year, when hopefully some form of normality will resume.
Perfect. Yep. So if you have any questions, please drop them at the chat, in the chat box. If you've got any specific questions from either of the companies that are presenting, or just general about the Northern Irish life and health sciences sector, we'd be very happy to take them. I've got a question for Neil Siga. Specializing in self-diagnostic testing, you said you can help create. Do you subcontract test development, or are you an end-to-end developer with full capability within your company? I think you're on mute, Neil. Sorry.
Okay, this is why I'll never get used to these types of meetings where you can be muted. No, we can do both. And the reality is, Sika Healthcare has based its reputation being ultimately flexible. If people want a finalized design product, we can do that. Or if they want something a little bit looser, a little bit something with some little added extras, we could do that as well. And because we've been doing this for so long, we have moved into many different fields and many different opportunities, not because of anything that we have said, but more because our customers and partners have come up to us and said, I've been approached by a partner, can you do this for us? And because the truth is, in any business relationship, then partner has to be able to go out and make good margins, because if he's not making good margins, they're not going to be interested. So yes, the answer is yes, we can do either or both, or anything that you want. It's just because we've got a lot of knowledge. In our regulatory team alone, we've got close to 250 years of experience. So if there's issues with CEs, FDAs, whatever it is, and I think Jeffrey was talking about the success he had in Australia, that's an equally difficult regulatory body to get across. So we know what we have to do, and we can create and do anything that any partner wants us to do.
Fantastic. I've got a question for Jason and Neurobalance. Will the future obesity products be over the counter in EU and UAE?
Yeah, we intend that to be the case. So certainly for our FDA approval in the US, which we would then hope to leverage into the Middle Eastern regions, that would initially be on prescription. So we'd probably follow the same path. So initially on prescription into Middle Eastern, following, this was registration as a medical device there, but then with a plan eventually to move to OTC.
Fantastic. We've got a number of comments from distributors who are interested in partnering with companies, so that's great. A shout out to Midhat. Thank you. We've got your message here, and I'll be in touch. And for everyone else listening in as well, my contact details are right here. So do drop me an email if you have any questions. I guess in conclusion to the session, my final sort of question to all of you here is, obviously, a number of our viewers today, people who are listening in, are either distributors or they're professionals working within hospitals or the healthcare sector. So what would your sort of quick final message be for people who are listening, particularly in terms of competition? Obviously, many of your products are innovative, groundbreaking technology, etc. But it might also have competitors, from other countries or within the UK. So in a nutshell, quickly, what would you say your key USPs are and what your final message to people who are listening in today will be, starting from Jason.
I think our strength is really we're ready to commercialize with two, well, I would say approved devices pending approval. So imminently approved devices that we've already been selling in other territories. So we're ready to rapidly move into the area of treating neurological disease for insomnia and anxiety in the Middle East. And certainly that's our great strength right now. Great.
Mark?
I'd say if you're looking for a business that can complement your current recruitment channels and add value through the services we offer, the experience we have in the Middle East. Personally, I've been recruiting in the MENA region for 14 years now. Then please speak to us. We'll be happy to have a chat and see if there's a partnership there that we can garner from this.
Great. Roy? You're on mute. Sorry. Happened.
Okay, sorry. My message would be that the TriTemp non-contact thermometer is a robust, reliable, accurate, and consistent alternative to ear thermometers, and we've proven this because it's used in multiple hospitals, major hospitals across Europe and the UK, South Africa, and Australia. Thank you.
Philip?
Yeah, just if your point of care diagnostics is a very rising area, and if you are looking for any sort of clinical diagnostics, including COVID testing, please do get in touch.
Great. Neil?
Well, Fad, I could spend all day talking about our company's strengths, but I won't. I'll mention just 3 words: quality, range, service. Quality, we have all of the regulatory marks that we need to sell all of our products across the world. Range of products, we have an unending number of products, and most importantly is service, because in the end that's all that matters. There's not much point of doing deals with companies and saying it's going to arrive at a certain time if it arrives 6 months late. So that's the 3 components of CK Healthcare success. It's quality, range, and service.
Great. Liam?
Yeah, I suppose our USP is that there are no other speech generating communication devices that work in an ICU with ICU patients who are unwell. The other devices, the other applications are just wholly unsuited for that. So we are the only one that will work with these unwell patients with impaired speech.
Mm-hmm. And Jeffrey? You're on mute, Jeffrey. Sorry.
Yeah, I would echo what most of the other panelists said. Was basically the uniqueness of the product, but with regards specifically to Medizor, it's the effectiveness of the product, and the fact that we have worldwide regulatory certification authorization. At the end of the day, we're all sales organizations, so it's easy to make claims for our products. It's a different kettle of fish if a clinician or hospital group turns around and say, how can you prove this? If we said kill them, or say, how do you prove it? We have certification for all the claims we make, and we find that has been an extremely useful tool when we speak to the various government bodies.
Fantastic. On that note, I'd like to say a big thank you to all our panelists, Jason, Mark, Roy, Philip, Neil, Liam, Jeffrey, and my colleague Paul as well. Thank you all for coming along today and delivering this session. I know we're in challenging times here. In a normal situation, we would be sort of finishing up with Arab Health at this time, having those face-to-face interactions with stakeholders and friends from across the region. And also a big thank you to all our attendees as well. I know everyone's got busy schedules with a lot of competing priorities and an overload of webinars. So we're really, really thankful that you attended, and hopefully you found useful listening to the fantastic innovations coming out of Northern Ireland. As I said, my contact details are mentioned on the slide here. Do get in touch, if you want to set up one-to-one meetings with any of the companies here, or if you have any further questions or need clarification or any element on this note, I'd like to again say a big thank you to all my colleagues and panelists, and of course to the...
Sorry, Fad, before you leave, I'm sure I could take this opportunity for everybody else in the panel to thank you and your team for all the hard work that you've done. It's been very much appreciated by everybody on this panel. So once again, thanks for your time and effort.
Thank you.
Yeah, thank you.
Thanks, everyone. Thank you. Thank you, everyone, and have a good day. Thank you for attending once again. All the best. Bye-bye.
Bye-bye. Bye-bye.
Bye.